Welcome back. We're going to talk about your tongue placement today. It is very important. Got a lot of good, valuable information, so stick around and you will learn something, I am certain. My name is Becky Moore. I'm with Restart Hygiene, and I'm here to help you learn about improving your oral health, which definitely affects your whole body. This is a big one today, so stay tuned. I think you're going to enjoy it. So understanding the reason, the position of our tongue, and why it matters is what we're going to talk about today. So it affects your overall health, not just your mouth, believe it or not. So there's reasons for it. When you don't have proper tongue placement, it can affect your growth and development, your speech, your teeth alignment, even your airway. That is a big one. You have to have air to live. A good airway is essential for health and your body health. So let's talk about the common issue of mouth breathing. Once you start looking at this and start being mindful, it will blow your mind. It's interesting. I like the people watch as I've gotten older. An old teacher in school, in high school 35 years ago, talked about how people watching was fun, but at that time I didn't have time for it. Well, it is fun to watch. But anyway, when you notice the people walking around with their mouth open for no good reason, that will scare the bejesus out of you. So mouth breathing is an issue, much under the radar. There's not a lot of talk about it. So that's where I really want to focus today's lesson so you can learn. So sometimes for mouth breathing, we say it's for no good reason. Sometimes it's not, but sometimes there is a valid reason. Sometimes you have allergies. Sometimes you have your nose is stuffed up. Sometimes you have a deviated septum. If your tonsils and adenoids are large, you're not going to be able to nose breathe as easily. And the body's going to do what the body does best. It's going to overcome any obstructions. And again, you have to have air to live. So your body's going to find a way to get the oxygen that it needs. The problem is it doesn't get the proper oxygen from mouth breathing. Nose breathing allows us to have nitric oxide. It helps with our reproductive system. It helps with our heart health. It helps with many body functions. And so it's important that we try our best to get you to have your tongue in the right place so that you can nasal breathe. That is very important. All right, so one reason we said was because of allergies, seasonal allergies. Again, the deviated septum, back of the throat could have an airway blockage, which is going to force you to breathe through your mouth, not your nose. The other thing is for parents to know is that the extended use of pacifiers and bottles is really harmful to our children, much more than suspected even a few years ago. And you don't know what you don't know. So this is important for mothers and fathers to listen to, pass it on to your neighbors if they have children. So pacifiers and bottles do not encourage your baby's tongue or your child's tongue to go to the roof of the mouth, which is where your tongue really belongs. So that's one benefit of breastfeeding, is that the breast actually goes into the mouth, opens the mouth up, keeps it in a good position, puts pressure on the palate, which then makes the palate grow like it should. When your tongue lays at the floor of your mouth, your palate can't grow. We a lot of times have narrowed arches on our top of our mouth, our palate, and that would be crowding teeth, and that's an airway issue. So, also, the tongue placement can affect the size of the actual opening of the airway. I've seen patients that had very large tongues that rested in the floor of their mouth. And at that time, I was not educated on mouth breathing and the effects of the airway and how I could support it as a dental hygienist. So didn't even realize that a big tongue laying on the floor of the mouth surely represented an airway issue, sleep apnea, and contributes to other diseases like we said, the heart disease. It can affect the quality of your sleep, because if you have sleep apnea, if you're falling asleep and your body can't get enough air, then it's going to be waking up often. So you're not getting good sleep, and that's another rabbit hole. So remember that as well. We talked about the effects on teeth, but effects on a growing face. So when your child is in that growth development, especially, well, their whole growth, the whole childhood is growth and development. If they're mouth breathing, their face is going to be longer. It's not going to be around like a square head, which is what we had years and years ago when we were more balanced. It's going to be a longer, narrow face. Could be dark circles under their eyes. And so this is going to affect the way that the child's face grows into adulthood. And once it grows that way, it's not going to change. So it's important that we do all we can at this point. The next thing to know is that incorrect tongue posture, where your tongue rests, can affect the way your mouth develops. Again, we talked about if your tongue is on the roof of your mouth, it's going to put pressure on that bone, and it's going to help that palate to grow to be wider, whereas no pressure is going to cause it to be really narrow. And you see that a lot of times with thumb suckers. The reason that we put our thumb in there is to get some kind of satisfaction of releasing endorphins and trying to give ourselves that complacency that our tongue should give us, but sometimes that just doesn't happen because sometimes there's tongue attachments that won't allow that to happen and some other things. So it's important to understand all these concepts and how they work together. You can correct your tongue posture. That's the good news, is you can correct your tongue posture, and I'm going to show you how, so stay tuned. So let's talk about, we understand the importance of incorrect tongue posture. Let's talk about correct tongue posture and how we can improve it. So first of all, you can use tongue muscle exercises to help you improve that. A myofunctional therapist is somebody that can go in and identify where your tongue is at, and they can help you increase the muscles around your supporting tissues in the mouth and the throat that can improve those muscles. And we all like improved muscles. That's why we get out and work out. All right, so you can strengthen that just by putting your tongue at the roof and holding it there, just doing that a couple times a day like we do our Kegels or anything else. Also, there's underlying issues sometimes, like we talked about, for the tongue not to go in the right place. Sometimes there's an attachment under your tongue that will not allow it to go there. That should be addressed. So these are some things you want to make sure that there's any decongestion or any obstructions in the nose and the airway, that we address those, that we address the back of the throat and the airway and make sure that the tonsils are not so large that they're blocking that as well. That can definitely be an issue. So that's where you would see your dentist, you would see your MD, and possibly an ENT, an ear, nose, and throat doctor. So those are some things to help you too. All right, so let's talk about correct tongue posture. I want to show you how to do it. You ready? All right, what you've been waiting for. All right, so correct tongue posture would be to put your tongue at the roof of your mouth, right behind your front teeth, but not pushing on your teeth. Your teeth are going to be slightly apart, and your lips are going to be together. So let's do it together. How's that feel? It felt weird for me when I first did it too. So again, tongue at the roof, teeth slightly apart, lips together. I want you to do that when you are not chewing, eating, or talking. So when you're driving down the road, when you're working on your laptop, when you're playing a game, when you're watching TV, when you are going to sleep. If you wake up in the middle of the night, I want you to make sure your tongue is at the roof, your teeth are apart, and your lips are together. This is correct tongue posture, and this is a great place to start improving your oral health. All right, it's more than just cosmetic. For me, it's not cosmetic, just like braces are not cosmetic. With having the correct tongue posture, identifying it early, we can reduce a lot of the effects that your children are going to have from this. So if your child has ADHD, they're bedwetting, they're clenching or grinding, their gums are really red and inflamed, they are tired in the afternoon, that's likely a mouth breathing issue, and the tongue probably is not going in the right spot. So it's something that you definitely want to monitor. You want to be mindful of, do your research, and help your children and help yourself too. We don't want you to be unhealthy, and mouth breathing and incorrect tongue posture can make you unhealthy. It's never too late to start paying attention. Never too late. I have patients in my chair that are 80 years old that I'm telling this to do, and they look at me and they're very appreciative of it because they start to put together the pieces. Mouth breathing can affect many body functions, like we talked about, reproductive, heart disease. So we want to make sure that we're doing all that we can to keep our mouth and our bodies as healthy as we can. Thanks for watching. I thank you for sticking with me. Please like and subscribe if the video helped you. And I will be back again for some more useful information.